Hello and welcome to the online module. This presentation will review the intersection between children's experiences of homelessness and child protective services involvement based on previous empirical research and studies completed by the presentation team. Our project team at the University of Minnesota includes Sun-Kyung Lee, a doctoral candidate in Family Social Science Department, who will be presenting part 1, and Alyssa Palmer, a doctoral candidate from the Institute of Child Development, who will be presenting part 2. Financial support for this research was provided by the University of Minnesota through the Grand Challenges Research Initiative, Office of the Executive Vice President and Provost, and federal 4E funding through the Minnesota Department of Human Services and the Center for Advanced Studies in Child Welfare. In this module, we're going to give you an overview of how the experience of homelessness and high mobility may affect school performance and explore methods for mitigating that risk. Further, we aim to understand how the experience of homelessness and high mobility may confer additional risk and often co-occurs with other forms of adversity, including child welfare involvement. Finally, we aim to assist you in evaluating and reflecting on how to apply the information identified in the presentation to your own professional roles in the field of child welfare. We will first provide a general overview of childhood homelessness and then discuss 2 individual projects completed through the Minnesota Linking Information for Kids project. We will conclude with resources and general practice key takeaways. In January 2020, federal education data from the National Center for Homeless Education, the U.S. Department of Education's Technical Assistance Center, showed that public schools identified 1.5 million children and young experiencing homelessness in the 2017 to 2018 school year. This is an 11% increase from the previous year and the highest number ever recorded nationally. Issues of child homelessness are also common in Minnesota. According to the Minnesota Department of Education report from the 2017 to 2018 school year, there were 8,079 students who had experienced homelessness on October 1st, 2018. This represents about 0.1% of the total student population. Students experiencing homelessness are disproportionately students of color and often have difficulty in the school setting. Students experiencing homelessness miss 4 times as many days of school, were 9.5 times more likely to be chronically absent, and were less proficient in math and reading. Specifically in Minneapolis, previous research has suggested that the achievement gaps appeared stable or widened for homeless and high mobile students and other risk groups from 3rd to the 8th grade from 2005 to 2010. Math and reading achievement were lower, and growth in math was slower for children identified as homeless and highly mobile, suggesting acute consequences of residential instability. Nonetheless, it is always important to note that 45% of students identified as homeless and highly mobile scored within or above the average range, suggesting academic resilience. Developmental cascade theory would suggest that the existence of one event or factor perpetuates the risk for others. In some situations, this means that risk begets risk, such that the experiences of homelessness increase the likelihood of other adverse events occurring. This also suggests that a positive event can increase the likelihood of other positive events. The accumulation of risk factor has been most popularly associated with ACE studies or adverse childhood event studies. This work suggests that cumulative risk exposure is related to child adaptation at school. Here, we highlight a paper by Blodgett and Leiningen in 2018, whereof the students who had 2 or more areas of school problems, 82% also had 3 or more adverse experiences, and only 12% had no documented adverse experiences. In the same study, They also reported that students who had 4 or more adverse experiences were 4.5 more likely to have attendance problem and 6.9% more likely to have school behavior problems. This is all to say that risks accumulate for children, and these accumulating risks have been related to difficulties in school. In order to understand how multiple risk factors are related to children's experience of homelessness, both studies have utilized integrated administrative data. This was made possibly by the Minnesota Linking Information for Kids program, or Minn-LInK. They house data from multiple administrative sources from child and family serving systems. Minn-LInK researchers then identify individuals and connect their data across these sources. We hope to highlight how important and powerful population-level administrative data can be in understanding service utilization and developmental trajectories of adaptation within a population of children experiencing homelessness. I am Sun-Kyung Lee, a current PhD candidate in the Family Social Science Department at the University of Minnesota. So in this study 1, we looked at the profiles of homeless children and their relationship with high school graduation. As introduced briefly in the introduction, homelessness increased the achievement gap and is causing additional barriers to academic outcomes. Based on the 2020 Wilder Research Report on the 2018 Minnesota Homelessness Study, nearly half of parents experiencing homelessness reported that at least one of their children had to change schools because of their housing situation. 43% reported at least one of their children had learning problems that required additional services. The most common issues parents reported related to academics were having lots of absences and poor failing grades. At the national level, students experiencing homelessness were 87% more likely to drop out of school than their house peers. Having a high school diploma is an important protective factor to prevent intergenerational homelessness, because without a high school diploma, youth were 4.5 times more likely to experience homelessness later in life. Despite the hardship, in 2018, 46.8% of students experiencing homelessness graduated in 4 years, and 56.5% in 7 years. However, there were racial disparities in graduation. American Indian students experiencing homelessness showed a lowest graduation rate, with 34.4% graduating in 4 years. As introduced with the developmental cascade theory, homelessness co-occurs with other risk factors such as child welfare involvement. In Minnesota, the adverse childhood experiences has an entry into homelessness. When asked about ACEs to homeless adults, the majority, about 73%, had experienced at least one, and over half reported multiple ACEs. These experiences have the added negative effect of accelerating entry into homelessness. For each ACE reported by homeless adults, the average age of the first homelessness experience dropped considerably. In addition, half of young adults had been out-of-home placement as a child. Again, having experienced an out-of-home placement as a child decreases the average age of the first homelessness experience. For example, age 21 for those with an out-of-home placement and age 31 for those without. Therefore, in previous studies, it was found that the homelessness and child welfare systems are closely linked. Notably, the risk of CPS involvement increased with longer or frequent homeless status. Toro and Cleeks have shown the extensive existence of diverse groups within the homeless population. Those include a wide spectrum of experiences, backgrounds, and trajectories. The multiple causes of homelessness require complex solutions. Despite homeless system relying on cross-system collaboration to remove barriers that lengthen homelessness, community struggles to address the extensive pattern of needs within heterogeneous homeless populations. Homeless assistance typically requires multifaceted support that adapts in response to shifting demands and includes a unique combination of system supports. Despite the prevalence of complexity in the homeless population, limited studies have explored the various types or categories of homelessness across systems in the population level. With the limitation of homeless study, the study 1 of the training module will answer the following aims. Aim 1, what are the profiles of homeless children, including their involvement in CPS and OHP systems over 10 years? Aim 2, what are the disparities of children, sex, and race? Aim 3, are those who involve in both homelessness and CPS or OHP less likely to graduate? Aim 4, what are those subgroup characteristics in disability and timing of CPS or OHP involvement? Using Minn-LInK administrative data, we were able to link two systems, the Minnesota Department of Education and Social Service Information System, which include Child Protective Service data and out-of-home placement data. Minn-LInK based its matching with the education system data. So to represent the population of students experiencing homelessness in Minnesota, this study uses Minnesota Public School Records, also called as MARS, to identify homelessness across academic years from 2008 to 2018. Students' involvement in the child welfare system is based on data from the Minnesota Department of Human Services. All CPS and OHP accepted cases were included from 2000 to 2017. Following the homeless flag in the education system, this study defines homelessness under the McKinney-Vento Act. The homeless children and youth are defined as individuals who lack a fixed, regular, and adequate nighttime residence. The school system includes doubled-up households who share housing with others and other specific circumstances, such as family living in motels, hotels, emergency shelters, public spaces, and cars. The inclusion criteria for this study are all children in the record who were in grade 6 in the 2007 to 2008 school year and have at least one homeless flag across 10 years from 2008 to 2017 school year, which includes a 7-year graduation period from 9th grade in 2011. This ends up a total of 2,222 students who experience homelessness at least once across 10 years. This was 3.6% of total grade 6 students in the 2008 school year. The population group showed balanced sex and students with 51.4% of female students and 43% reported themselves as Black and 35% as white. For statistical analysis, the race was recoded to white or children of color. From the population, about 45.2% graduated over 7 years. Out of those who graduated in 7 years, about 69% graduated in 4 years, and the rest graduated gradually over 3 years. The mean attendance of students across 10 years was about 82%, which is below the cut line of 90% attendance. Based on the definition from the Department of Housing and Urban Development, chronic homelessness is defined as 3 or more years of homelessness. In our population, 11.8% experienced chronic homelessness, and the range varied from 1 to 7 academic years with a homeless flag. Having a median of 4 school moves in the population, moving schools 5 or more times in 10 years is considered chronic school mobility. 38.5% experienced 5 or more transitions in school in 10 years. And the range varied from 1 to 24 times of school mobility. Almost half had at least one CPS involvement, and about 28% had OHP involvement at least once. The primary focus of the study was to get profiles of children who experience homelessness. The study used a person-centered analysis approach called latent class analysis to identify unique groups of homeless students with shared characteristics. The analysis identified unobserved 4-class solution. First class was 34.7%. In a yellow line showed moderate chronic mobility, very low attendance, more than half got a suspension, and around 40% had CPS involvement, but low OHP involvement, and we will call this as a low attendance group. The second group was 22.3%, with orange line, which shows high probability in all risk factors, with notably high in school mobility, with low attendance rate, CPS and OHP involvement, and we call this high risk group. In third class, it was 28.5%, which were classified in a green line that had low probability in all risk factors with no chronic homelessness or either CPS or OHP involvement. And we called this as a low risk group. And lastly, in fourth group, it was consisting of 14.4% in blue line, following a similar pattern with the low risk green line, but had a distinctly high probability in CPS involvement and moderate OHP involvement. And this group is called the high maltreatment group. Then we examined student sex and race as predictors of involvement and identified 4 groups by using manual 3-step approach. Setting the high risk group as a reference group, girls were 1.35 times and white students were 3.43 times more likely to be in the low risk group. Again, girls were 1.65 times and white students were 3.72 times more likely to be in a high maltreatment group. No difference was shown in sex and race with low attendance group. In summary, high risk groups were more likely to be the boys and students of color. This group was most likely to experience high school mobility and out of school suspension. Girls and white students were more likely to be involved in the child welfare system. In aim 3, the study examined the difference among identified classes with high school graduation as a distal outcome. The high maltreatment group showed the highest probability of graduation with about 70%, then the low risk group with the 68% graduating high school. 2 groups didn't show the mean difference in the probability of graduation. Next, about 30% of the high risk group and the 29% of the low attendance group were expected to graduate high school. More specifically, low risk and high maltreatment groups showed a higher portion of students graduating in 4 years. The high maltreatment group shows high resilience in academic performance regardless of the high probability of CPS involvement. Overall, regardless of CPS or OHP involvement, homeless students who experience chronic mobility or low attendance rate and more out-of-school suspension were less likely to graduate within 7 years. For homeless student graduation, experiences that are more closely related to homelessness, such as school mobility and low attendance, may be a critical factor to predict graduation rates than the involvement in child welfare. Lastly, in aim 4, the study looked at the intersection of disability and special education. The study focused on special learning disabilities or emotional or behavioral disabilities. Homeless students with emotional or behavior disabilities had an association with having both CPS and OHP involvement, more likely to be involved in the high-risk group. Then we looked at the relationship of homelessness with the first event of OHP or CPS involvement. The timing of child welfare involvement is divided into 3 stages: preschool, elementary, and teenage period, which includes middle and high school. Across groups who had CPS involvement, there was no difference in the first CPS event, but in all 3 groups, homeless children tend to involve in their first CPS involvement during elementary school. On the other hand, in OHP involvement, homeless students who experienced their first OHP involvement during their teens were more likely to be involved in the high-risk group. Late OHP involvement may be a critical barrier towards graduation. In a nutshell, we found heterogeneity within children who cross over homeless and child welfare involvement. Thinking of the diversity of this population, a one-size-fits-all approach services is inappropriate. This shows the need for coordinated action across systems to address homelessness. High school mobility, low attendance, and high suspension were the critical risk factor for homeless students in achieving a high school diploma rather than child welfare involvement. Consistent with Rodriguez and Shin paper in 2016, this study implies that preventive strategies that aim at both homelessness and child welfare service systems should focus more on reducing homelessness than on reducing child welfare involvement, as getting a high school diploma can be a protective factor to prevent intergenerational homelessness. Also, the professional should give particular attention to boys and students of color who are highly mobile, receiving a special education and suspended at least once. Emotional and behavior disability was related to high mobility and late OHP involvement. Homeless students who experience OHP involvement during their teens may need mental health support and a support system for those who may age out of foster care. Still, it should be noted that about 16.6% of homeless and high mobile students showed high academic resilience by achieving a high school diploma.